symptoms and signs of stroke. Stroke is a sudden event. So any patient or any neighbor we come across having these symptoms and signs being has to be remembered as BEFAST. B stands for loss of balance. So if a patient is walking, he is not able to walk in the straight line, or simple small steps also he sways or he falls on one side. Second is the E. E stands for eye signs. Eye signs can be in the form of diplopia, means double vision. Second, in a full picture, he is not able to see some part of the things. Thirdly, it can be abnormal movement of the eyes, like inward or outward movement of the eyeball. And lastly, there is a complete blindness, loss of vision, can be the visual symptoms. Next is FAST. FAST, F stands for facial deviation. There can be asymmetrical drooping of the angle of mouth or deviation of the angle of mouth. A stands for arm weakness. Arm weakness can be a upper limb, lower limb weakness, or both upper and lower limb weakness, hemiparesis, monoparesis. There is a sudden inability to hold the objects, heaviness of the limbs, not able to lift the hand overhead can be the symptom. Fast. S stands for speech. Speech difficulty, it can be a change in the clarity of the voice, or if we are asking some question, patient is not able to answer back, or there is a irrelevant speech. T lastly stands for time is brain. So brain, if these symptoms happen, we have to act instantaneously with as early as possible. Understanding the risk factors of stroke. So risk factors of strokes are firstly the poor control of diabetes if the patient is diabetic, the poor control of hypertension if the patient is hypertensive, dyslipidemia or hypercholesterolemia, addictions, especially the smoking, alcoholism, poor sleep, sedentary lifestyle, these are, and eating the canned foods. These are the most common risk factors. Some percentage of the patient also have cardiac risk factors like ischemic heart disease or valvular heart disease also contributing to stroke. So the most important aspect of stroke day is to create awareness among the people about the prevention of stroke, because 90% of the strokes can be prevented by adapting a good lifestyle, healthy lifestyle, and preventing the risk factors. So firstly is having a regular exercise, 30 to 45 minutes of daily exercise, good sleep habits, 6 to 7 hours of sound sleep, less stressful life, prevention of the diabetes or control of diabetes, control of hypertension and hypercholesterolemia, and lastly, not the least, is the prevention of addiction like smoking and alcoholism can prevent 90% of the stroke. Thank you.